Hello, everyone. I'm Alice Park, Senior Health Correspondent for TIME, and I'm joined by the CEO of the National Alliance on Mental Illness, Daniel Gillison Jr. Daniel, welcome to TIME100 Talks.
Thank you. Good to be with you this day, Alice. Thank you very much for TIME100 Talks and this opportunity.
So let's start with the obvious, which is that the mental health support system in the United States really has not been super robust. Why do you think that is?
Underfunded, underrepresented, minimized to a certain extent. You always look at this space and this sector as follow the money, and the money has been invested for the most part in physical health and not mental health. And we know there is no physical health without mental health, but in terms of the funding, it's always been an opportunity to fund at a higher level with more significant support.
And nothing reveals weaknesses in a system like a crisis. And it's the pandemic, the COVID-19 pandemic has certainly exposed some hard truths about our mental health system and how we care for mental health in this country. As the pandemic unfolded, what have been some of the biggest challenges that the crisis has made more obvious in our mental health system?
Access to services and delivery of services. Both of those are on the pendulum of being able to provide to individuals living with mental illness, and also to the support for the families of individuals living with mental illness. So resources and access have been the most critical areas of exposure during COVID. Telemedicine has helped, and it's been great support, but there's still those areas of need.
Do you see any programs, you just mentioned telemedicine, like telemedicine, that you hope will continue once we're through this pandemic and potentially even strengthen the mental health care system that we have in this country?
Yes, in terms of strengthening the mental health system, we absolutely see telemedicine being something that must be continued as we come out of COVID. When we went into COVID, Alice, we already had a fragmented mental health system. I liken it to New Orleans and the levees that broke. The Army Corps of Engineers had been saying for over 10 years that if there's a Cat 5 storm, these levees will not be able to hold, and that's the same thing. This fragmented mental health system, we've known that it's been fragmented for some time, and now we're at the point where we recognize that coming out of COVID, we're going to have to look at doing things very differently to address the demand, and the demand is going up.
And of course, we had not only the pandemic, but we've had the combination also of racial tensions that have really come to a fore in this past year in the United States. And I wonder if so many people, when they think of mental health issues, they think of very personal ones, personal trauma, depression, very individualized issues. But I think we've learned in this past year that the stressors that can really tax mental health can be societal as well. Can you talk a little bit about whether these types of stressors are different from the ones that I think most people are familiar with? Do we think of them and should we treat them any differently than the individual stressors that can come from family tensions, losing a job, self-esteem issues, things like that?
Yes, we should treat them differently. When you look at structural racism, and if you look at some of the other pre-exposed areas, if you will, you have to look at them differently, and you have to look at them through a lens of pre-existing trauma, pre-existing stress, daily stress, and what that means in an individual's life, and the anxiety that brings, and the trauma that is daily. So yes, I think you do need to do that, and you need to be very aware of what is taking place in different communities and how communities react.
And I know that you've worked a lot with community outreach in terms of raising awareness about where the gaps are in the mental health safety net. Can you talk a little bit about some of the programs that you've seen that are very effective in addressing and bridging some of the gaps that we currently have?
Well, in terms of the gaps, I think the first thing is looking from our youngest to our oldest. So we're talking about our young students all the way to our seniors. And in terms of addressing the gaps, one of the first elements of addressing the gaps is definitely telemedicine. Now let's talk about our young students. They're school social workers, they're school mental health professionals. And when the schools are not in session in person, access to those services changes. So providing those services has been challenging, but also there is that access through technology. And that what we're seeing with the seniors is starting to use pads and I guess you can say technology to support some of the needs in those spaces as well. The other thing that we're seeing is, there has been legislation that's been passed on 988, which will be, right now there's a 10-digit national suicide prevention phone number. That number is going to actually sunset, and there will be a new number, and there will be a 988 number, and it will be for suicide prevention and mental health crisis. So we will see that in approximately 2 years. The legislation is already passed. And what that will do is that will provide a different type of a response to an individual that is having a mental health crisis. So instead of dialing or calling or punching 911, you will punch 988. And what the opportunity is for us to build infrastructure so that the communities will respond with a mental health response versus a law enforcement response.
I think that's a great segue into this next big issue, which is you brought up the differences between physical issues and mental health issues and how we don't treat them the same in this country. And I was curious to get your perspective on why you think that is. Why is it so hard to acknowledge mental health as a health issue that's equal and on par with physical conditions? We think nothing, for example, of asking for a day off work if we have a back injury, but we don't even think about that if we need a mental health day. So how do you change that culture and change the way we even approach mental health so that it does become on par with a physical condition and that we can get resources devoted to it?
Thank you. First of all, it is with the question being asked as you're asking it right now, and then it's having the conversation, and it's advocating for that change, and it's saying we need to speak up. It's with mental health, sometimes it's invisible. Physical health, you have young people that have knee injuries, ankle injuries, all types of physical injuries, and it's very visible. Mental illness sometimes looks to be invisible. And also, a lot of times the human experience is that in society is you want to be distant from it. But we know that 1 in 5 live with mental illness. And we also know there's been a 40% increase over and above that 1 in 5 during COVID in terms of anxiety and depression. So the mental health is at risk. And where we're going with it is that we don't want it to be invisible. We need to talk about it. We need to bring relevance to it and say, just like physical health, mental health is critically important. And NAMI is the largest national grassroots organization with over 650 organizations in the field where the rubber hits the road in communities addressing this on a daily basis and seeing it on a daily basis. So we're trying to make sure that it is not invisible. And just like diabetes, just like lung disease, that we look to treat it. So, and we look to acknowledge it.
So the pandemic and the racial tensions that we've seen in the United States in the past year have certainly tested the human spirit, but they've also revealed how resilient human beings can be What are some of the ways that people can start to find that resilience and tap into its power?
Yes, in terms of resilience, it's so interesting that you use that word because in speaking to a doctor on yesterday, a mental health professional, that was the word they used in terms of resilience. I think it goes to the values of NAMI, quite frankly, inclusivity, fairness, equity, and most importantly, hope. And I think that what we're looking at is really building on that hope and ensuring that we can look at what we can do versus what we are living through. So we are trying to do programming, and our programming, we've been a very much of a touch and a facilitated learning organization. So our programming has had to pivot and go online. But we're still doing that outreach, and we're increasing our numbers through that outreach. And inside of that, we're trying to increase the resiliency and the hope and the caring. So I think it's bringing together leaders like myself, organizations like NAMI, to talk about what can we do coming out of COVID, what must we do, and what can we do to help the individuals living with mental illness and their families understand that there is a light at the end of this long tunnel.
And as you said, it is indeed a long tunnel, especially this past year. What gives you hope when you look at, let's say, where we might be 5 or 10 years down the road as far as resources and support for mental health issues?
What gives me hope is that we have leaders that have come together in the mental health space to actually look at what the system should look like going forward. We know that if we keep doing what we've always done, we're going to get what we've always had, and we know that that won't work. So we need to have a transformative model of looking at the whole tapestry of delivering services differently. And I think that the 988 legislation and some of the other policy work that is taking place is really going to add to what we can do. Also, funding. If we look at the funding that we're currently very interested in and very passionate about, we hope that a significant amount of that funding goes to mental health. So that's what gives me hope. And the other part of that, Alice, quite frankly, is our young people. They come to this area very differently than my generation. And what I mean by that is that when they come into the workplace, they will share with the employer that I live with a mental health condition. What do you provide in terms of benefits? So they're much more assertive and much more open, where in previous generations, we would not share that information. They will share it. And many of our CEOs now look for their workforce to, when an employee says, I need a mental health day, guess what? That new CEO is receptive to that. So what gives me hope is the new leadership. And that leadership is coming from our young to our newest CEOs in the private sector in terms of their receptivity to that employee that is speaking up and sharing their mental health condition. Dan,
thank you so much for joining us today and discussing some of the challenges as well as progress that's being made in addressing mental health in this country. We really enjoyed the discussion. Thanks for joining us on Time 100 Talks.
Thank you very much for the opportunity, and we appreciate all that you're doing because it will take all of us, and we are in this together.